people with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning and welcome into the program, Mon Health Talk. I'm Dave Wilson. Our guest this morning is Dr. Lola Burke, addiction medicine, family medicine, and primary care. Dr. Burke, good morning. Thanks for joining us.
Good morning. Thank you for having me.
I appreciate you taking some time. We'll get into the subject today. We're going to be talking about recovery care, but before we do that, we make you talk about you for at least a minute or two. So, Dr. Burke, tell us a little bit about your background, where you came from, where you went to school, and how you ended up practicing with Mon Health.
Sure, absolutely. So, I was born in Charleston, West Virginia, and then I grew up in Morgantown. I graduated from University High School, and then I went to WVU for my undergraduate.
Where'd you go from there? Uh-oh. Oh, no. We lost Dr. Burke. And that was right after the governor was talking about the advancements in wireless technology. Tell you what, we'll take a break, and we will get Dr. Burke back on the line. Stay with us. You'll listen to Mon Health Talk here on a Monday morning. Back in a moment.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Dr. Lola Burke is our guest this morning, addiction medicine, family medicine, primary care, and we've got Dr. Burke back on the line. All right, Dr. Burke, we made it to, you went to WVU before technology let us down there, so you can pick it up from there. You went to WVU and take it away.
Okay, sure, yeah. So I also went to WVU for medical school, and then for my third and fourth year of medical school, I finished out over in Martinsburg on that campus. And then I did my residency in Harpers Ferry, West Virginia. So, and then I was practicing in South Carolina for a few years, but I missed home. So I ended up coming back and practicing up in Preston County with Mon Health.
So how did you choose your specialty, or is it a case where it chose you?
Yeah, I mean, it was kind of a little bit of both, I think. So there were really a lot of things that drew me to family medicine, but the two main ones, I really liked the idea of being able to help people prevent problems from happening in the first place. And that's a big part of family medicine, working with people to get their screenings and, trying to live healthy lives. So I really like that aspect of it. I mean, all specialties do that somewhat, but just primary care is really the main group that does that. And then also, when I started medical school, I knew that there was this big shortage of primary care providers, especially rural areas. I think whenever I went to med school, I think it was like 20% of the state didn't even have access to a primary care provider at all. So I just wanted to be able to help fill that gap.
And what about addiction medicine? How did that become something you wanted to focus on?
Sure. So whenever I was in South Carolina, we just had a couple providers that did it, and I was trying to, again, kind of help fill the need that was there. And then I just really fell in love with it. It's different. It's like you really get to help people kind of rebuild their lives. And I mean, they're the ones doing the work, but you really get to be a part of that and kind of help them along. And it's great to get to see such big improvements for people's lives. So.
Dr. Lola Burke is our guest this morning here on Mon Health Talk. So what is the recovery care program at Mon Health?
So we are what's called an outpatient-based medication assistant treatment program. So what that means is we're a clinic, and we treat people for substance use disorder in a lot of different ways, including with medication. So really, it's really a critical service for our communities for a lot of different reasons. So, it's important to the people that we're treating because, like I was saying earlier, when people come to us, most of the time they're really not living very functional lives. They're, they don't have a place to stay, or they're living with family or friends. They don't necessarily have jobs a lot of the time. A lot of people have lost custody of kids. There's just a lot of things that are not necessarily going that well for them. A lot of them are on probation or parole, and then, we just really get to help them. They get in treatment, and they start finding jobs and, building lives and getting custody of their kids and, just really seeing a drastic change in people's everyday lives. And, it's also really important for family members, especially, our patients' children. We know that having a parent with substance use disorder really comes with a lot of negative outcomes for people, including the risk of developing substance use disorder themselves. And then it's also really important to the communities as a whole. The more people in treatment for their substance use disorder, you see lower crime rates, higher numbers of people in the workforce, lower healthcare costs, just a lot of good things from that.
So within the program, what types of services are offered in the recovery care program?
So we are what we call it a comprehensive treatment center or treatment program. So when patients come in, initially they're doing they have to come weekly for a group visit, and the group visit, first they do a group therapy session with our therapist for 30 to 60 minutes, and they're learning things like relapse prevention and coping skills and stuff like that. And then they do a group medication management visit with me where we talk about whatever medicines they're on to help with their substance use disorder. So that's once a week, and then they also do an individual therapy session with our therapist once a week for an hour. They attend at least 2 community meetings weekly, like Alcoholics Anonymous, or there's other different ones out there. And then once they've been with us for 90 days, it goes down to every other week, and then after a year, monthly. So that's kind of the main pieces of it. But then we also have a peer recovery program. I'm not sure if people are familiar with what a peer recovery coach is, but that's a person who's in recovery themselves, who's been in recovery for at least 2 years and has had training to be, support for patients. And so they will, they call patients if they're struggling and just keep in touch with them regularly. And then in our program, our full-time peer coach, she also goes to the emergency room, so people get screened there. And if they have concerns about substance use disorder and they're willing, then he'll go in and talk to them there and sometimes keep in touch with them for a few months. And a lot of people do end up getting in treatment after being in touch with him for a while.
Dr. Lola Burke, our guest, addiction medicine, family medicine, and primary care. We often talk, or at least on this station, on my show, Talk of the Town, about the drug problem, particularly here in West Virginia, and the need for these types of treatment programs. So how do you first approach someone who may have an addiction problem and is in need of treatment? How do you even broach that topic with that individual?
Yeah, so that is a tough thing to know sometimes. But as providers, a lot of times we'll do something that's called motivational interviewing, where you're kind of assessing, okay, where are they in this process? Do they think that they have substance use disorder and that they need treatment? Do they know that it's an issue, but they don't want to get treatment? Are they ready for treatment? And then once you kind of learn that, then you try and help them figure out, okay, why are you at this point, and how can we move you forward? For family and friends, a lot of times that's also really challenging because they may want to help someone, but they may be frustrated, or again, the person may not quite be ready for treatment. And really, the main thing that people in that position can do is just to make sure that the person knows that they are supportive of them, getting treatment, and will do whatever they can to help them if they want to get into treatment. Sometimes it's hard to know what the resources are in the community, but there are some websites you can go to. It's called OFLAC website, or there's Help for WVE website. They have a list of different programs that are available for people. So,
is it? This sounds like a strange question in my head, but I'm going to throw it out there anyway. Can you be an addict or be dealing with substance abuse disorder and not even know it? I suppose most addicts don't know it until it's pointed out to them. I mean, how do you see it?
Yeah, I mean, a lot of people initially, before people get any kind of treatment at all, they kind of think that they know they're using these substances, but they feel like they can control it. That if they're only using when they want to use, and if they needed to stop or wanted to stop, they would be able to just stop. It's a lot of times it's really when it starts to affect their everyday lives and they start losing jobs and things like that, that people are like, okay, yeah, this is not working for me anymore. I don't want to live like this anymore. And then they'll seek treatment at that point.
So what would an initial appointment in the recovery care program, what would that entail?
So it's a pretty long visit because we really, we're really trying to get to know our patients and figure out, okay, where did you come from? Where are you coming from? What did you go through? How can we help you move forward? So I talk to them for probably about an hour. They fill out some different forms and just answer questions about their past and other treatment they've had, and then I just go through all of that with them. A lot of people they have depression, anxiety, a lot of bipolar disorder, that kind of thing, and so we want to make sure that those are diagnosed and being treated, or if not, how are we going to treat those things too? Because if you don't treat both of those issues, then people aren't going to do as well. Knowing what other recovery programs people have been to and what's worked for them and what's not, we need to get that information. So, and then just explaining to the patient how the program works and what we do is also a big part of that. So it's a pretty long visit, that first one.
We're talking about recovery care this morning with Dr. Lola Burke, addiction medicine, family medicine, and primary care. So how does your role play into this with the primary care and family medicine? How does that fit into the overall recovery care program?
Yeah, I think it actually works out really well. So, there's this huge stigma against people with substance use disorder, which has been there for a long time, unfortunately. And so a lot of our patients, when they get to us, they've had some really negative experiences interacting with the healthcare system already. So a lot of them are very distrustful of doctors or providers especially, but just healthcare workers in general. And so these people are, I was talking about preventing problems before. We're not getting the preventive care at all. They're not getting mammograms. They're not getting colonoscopies or flu shots or exercising, that kind of stuff. And they're not probably about 70% or so of our patients, they don't even have a primary care doctor when they start with us. And most of them aren't intending to do that. But once they kind of get to know our team and we build a rapport with them, we've actually had a lot of patients who have established with me also for primary care. So I see them for both. And then we get them their pap smears and their mammograms, and we talk to them about diet and exercise. And so I feel like being in a smaller area, without a lot of access to other health care, it really works well for people that I have that background. So,
got to squeeze in a break. We're talking to Dr. Lola Burke this morning, addiction medicine, family medicine, and primary care. And we'll continue that conversation right after this. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning is Dr. Lola Burke, addiction medicine, family medicine, and primary care with Mon Health. Dr. Burke, how do patients get into this program? Are they referred? Can you walk in and say, "Hey, I need treatment"? How do you get that first step?
Yeah, we're pretty open to all the different options. So a lot of our patients end up getting referred from our peer coach when he sees them in the emergency room. We get a lot of patients that are referred to us from other providers in the area. And then, a lot of people, they just hear from a friend or family member, and then they just call. Or we do occasionally, we have people that just walk in and walk up to the desk and say, "Hey, I want to see Dr. Burke," or "I want to get in the program." And then they'll get those people in touch with our program administrator, and she'll schedule them with an appointment. So,
what do you hear from patients who successfully complete the program and do get a handle on substance abuse disorder and get things turned around?
Yeah, so we, people, they just talk about how glad they are to have their lives back, and we've had a couple people who have been able to be in treatment on medication for quite a while, and then they're able to successfully kind of taper down off of the medication, and then if they still do well for a little while. I mean, people can leave when they feel like they're ready to, but mostly that's when we kind of agree that they're ready as well, as if they're off the medication and doing well, and just feel like they are able to handle any kind of the cravings and all that other stuff that kind of goes with lifelong recovery. And then, they can finish the program. And then of course, they can always come back in the future if they want to. But a lot of people actually need long-term treatment. So we do have people that have been with us for over 2 years at this point. But those people still express, they like and appreciate that they get to see family and go to work and just do all the things that a lot of us take for granted every day.
Talk a little more about the role of the peer recovery coach in this program and why that role is important.
Sure, yeah. So the reason I think that it's such an important piece, and it really has made a big difference in our program and helped grow the program a lot, is just because people know that there's that stigma out there, and they are mistrustful a lot of times of people that they don't know that well. But when you have someone that you know is in recovery themselves, they understand, they've been there, they know the hardships that go along with substance use disorder, and they know that people try and are in recovery for a little while, and then they relapse and they try again. They know what it is to be there, and so it's a lot easier for them to trust someone who's a peer coach than me when they first meet them. And so a lot of times, like I said, we've had a lot of people who our peer coach will meet them in the emergency room, and then he'll keep in touch with them and contact them every few weeks. And sometimes it's been 6-12 months he's been in contact with them, just offering them support and saying, hey, if you want to get in treatment, let me know. And then suddenly a year later, because of that contact with him, they end up getting in treatment and doing well. So, and also just our patients, if they're in the program and they've relapsed and they're struggling, again, sometimes they feel like they have to, they don't want us to be disappointed or whatever, but the peer coach understands. So they're more willing to talk to him when they've relapsed and are trying to figure out where to go from there than necessarily to the other members of the team.
Dr. Lola Burke is our guest this morning. If listeners take one thing away from our conversation today, what is that one thing you want them to remember?
I think just keeping in mind, substance use disorder really it's a chronic illness. It's a complex illness. People have this idea that if you have substance use disorder or addiction, we commonly call it addiction, it's just something that people are choosing. But again, we've known for a really long time that it's actually a chronic illness brought on really by a lot of different factors. So the biggest really determinants of who's going to get substance use disorder and who's not are actually genetics. Believe it or not, there's a lot of genes that play into this, and then also a history of childhood trauma. So most people develop substance use disorder in adolescence, and most of those people have a history of childhood traumas. People who have at least one childhood trauma are actually 5 times more likely to develop substance use disorder than people with no traumas. And if you have 5 or more, which, believe it or not, a lot of our patients have 5 or more traumatic events in childhood, it's about 10 times more likely chance of developing substance use disorder. So just keeping that in mind, it's a chronic illness. We're treating it in a lot of different ways. Just try and have a little bit of understanding and compassion for people. So,
where can you get more information about the program, contact information, the whole 9 yards there?
So we do have a section on the Mon Health website, monhealth.com/recovery, or you can also call and speak to our program administrator or one of our nursing staff. You can call the hospital's main number and ask for the recovery program, or if people want, it's 304-329-1400, and extension is 4301. And our program administrator is Jessica.
Dr. Lola Burke, our guest this morning, addiction medicine, family medicine, and primary care. Of course, so you can always go to the website, monhealth.com, for all of your information there on Mon Health. Dr. Burke, appreciate it this morning. Sorry about the little technology problem at the beginning, but it was pretty good from there on. Appreciate the time. Thank you.
Yeah, thank you.
Absolutely.